I'm a medical doctor by training and founder director of the Center for Health Research and Education. I've worked for the past 2 decades in India, the US, Singapore, and the UK in academic research and the industry. I specialize in developing and implementing global cancer prevention strategies. I divide my time currently between the UK and South Asia in developing and strengthening capacity among healthcare professionals for better delivering cessation treatments and services to the more than 300 million tobacco users in these two regions. About the Center for Health Research and Education, it is based at the University of Southampton's Science Park in Hampshire. We are a growing team of healthcare professionals dedicated to global cancer prevention with a very special focus on smoking cessation treatments and delivery. We believe that there's a massive gap in global tobacco control policy and practice, and that is preventing effective delivery of cessation treatments and services globally to the billion plus tobacco users. And we want to change that. We want to bridge that gap and make the world, or at least help make the world smoke free. It's urgent and more relevant than ever. As the world goes into lockdown, economic and health uncertainty, self isolation, and social distancing are bound to make the society very lonely and life very stressful in the short to the medium term. This could be a key trigger to smoking relapse among ex smokers and increased smoking among current smokers. In England alone, COVID-19 threatens to trigger a relapse to smoking among 11 million ex-smokers, as well as increased smoking among more than 6 million current smokers. Worldwide, the numbers are in hundreds of millions. That's a public health emergency. It's a known fact that smoking increases people's risk of acute respiratory diseases. And it's very likely that among smokers, there is an increased risk of serious complications from COVID-19. Of course, stress and worsening mental health are known predisposing factors for increased smoking, quantity of smoking, and also frequency of smoking, as well as relapse. And COVID-19 brings health and economic uncertainties with it. The feeling of helplessness will be pronounced when the usual comfort of friends, family, meeting people, socializing is not available. Now, bear in mind, many of the ex-smokers out there in this country and globally have managed to quit smoking using a variety of tools and techniques. They may have found a new hobby. They may have found a gym to go to, some ways to change their life and work pattern. In more practical ways, workplace restrictions in smoking might have forced them to change their smoking habit. Now, with social distancing, self-isolation, and a virtual lockdown around the world, these avenues may not be available. And that may be a trigger for people to go back to smoking. Now, those who are trying to quit smoking using existing services, even the face-to-face services are no more available. And that's also going to make it more difficult for current smokers to attempt smoking. And these are all reasons why we are worrying and expecting a massive increase among current smokers to continue and increase the consumption of cigarettes, and among ex-smokers to potentially go back to smoking. A clear message needs to reach all smokers, ex-smokers, and their healthcare advisors. These are understandably stressful times, but smoking is not the solution. All the COVID-19 related advice documents on government and GP surgery websites and the primary care consultations should include: one, warning people of this impending risk of relapse; two, offering strategies on staying smoke free with available cessation tools or quitting tools like nicotine replacement therapy products, nicotine gums, patches, nicotine mouth sprays, and electronic cigarettes. And finally, signposting to the resources already available, great resources available on NHS smoke free websites and apps. Current smokers are likely to have worse outcomes from COVID due to pre existing lung damage. COVID related social distancing, self isolation, and stress are likely triggers for millions of ex smokers to relapse and hundreds of millions of smokers to smoke more. These will claim millions of additional lives in the coming years due to smoking related cancer, cardiovascular disease, and lung disease. Brief and opportunistic advice by healthcare professionals and government agencies have the potential to avert this unintended and disastrous consequence of COVID.